of the House of Commons Standing Committee on International Trade, meeting number 24. Today's meeting is webcast and is taking place in the hybrid format pursuant to the House Order of January 25th, 2021. So I welcome all my colleagues back today on a beautiful Monday morning and the start of hopefully a very successful week. Pursuant to Standing Order 108 and the motion adopted by the committee on March 12, 2021, the committee will proceed with its study of Canada's international trade and investment policy, selected considerations concerning the COVID-19 vaccines. I'd like to welcome our witnesses this morning. As an individual, we have Brian Daly, partner Norton Rose, Fulbright, Canada; Marc-André Gagnon, Associate Professor, School of Public Policy and Administration from Carleton University; from the Canadian Chamber of Commerce, Mark Agnew, Vice President, Policy and International; from Providence Therapeutics, Brad Sorensen, Chief Executive Officer; and from Norton Rose Fulbright, Brian Daly, lawyer and partner, that I believe we are hoping he's going to get hooked up to join the committee proceedings. Professor Gagnon, you have the floor.
Merci beaucoup.
Thank you very much. I would thank all of the members of the committee, and I'm very pleased to be able to make a presentation that will focus on intellectual property surrounding COVID-19 vaccines, as well as ways to increase manufacturing production of these vaccines in Canada and abroad. I'm an associate professor in the School of Public Policy and Administration at Carleton University, and I specialize in political economy of the pharmaceutical sector. I have over 150 publications to my credit, and apart from my role as an expert witness for Justice of Canada in 2020 trial and in the Quebec Superior Court on the regulation of prices of patented drugs, I have no conflicts of interest to declare. In the early days of COVID-19, it was impressive to see how researchers around the world collaborated on open science principles by systematically sharing data, whether it was to sequence the virus genome to track its evolution and variation, or to produce protective or detection materials. In Canada, the federal government passed the COVID-19 Emergency Measures Act, Bill C-13, in March 2020, allowing for 6 months of compulsory licensing of any COVID-19 related technology to address potential shortages. This was not renewed, however, in September 2020, but the federal government can renew it at any time if needed. In May 2020, the World Health Organization established the COVID-19 Technology Access Pool, CIIT, based on open science principles to promote the exchange of expertise and knowledge related to technologies to combat COVID-19. The Medicines Patent Pool, MPP, funded by UNITAID, has also expanded its mandate to allow for the sharing of COVID-19 related patents. Initially, it was thought that the scientific effort would focus on technological collaboration and data sharing so that each country could maximize its effort to fight COVID-19. Unfortunately, the old reflexes of proprietary science, patents, and the technology monopolies quickly took over. No firm has yet agreed to share its technology with CIIT or MPP. Instead, each firm works in silos in order to maximize future revenues. For example, vaccine-owning firms have generally shown great reluctance to negotiate licensing agreements to allow for increased production. AstraZeneca has been more flexible, but this was part of the conditions of the Oxford University that provided the vaccine. Since firms' ability to make money depends on their ability to maintain control over technological know-how, this is not surprising. So each firm is trying to control what they have as intellectual property rather than allowing their licenses and to be able to maximize production. Even though governments have invested over $14 billion in vaccine development, it is still considered normal for vaccines to remain entirely monopolized by the private sector. The development of COVID-19 vaccines of Moderna, AstraZeneca, Johnson & Johnson, and Novavax has been 100% subsidized by public investment, but the vaccine remains monopolized by a patent owned by the company. But by giving priority to the property rights of the companies over the imperatives of global public health, we end up in the current situation where each country plays elbow to elbow in front of the company's doors so that they can agree to sell them doses and deliver them as quickly as possible to their country rather than to their neighbor. Regardless of global public health priorities, it's every man for himself. However, while Canada is doing well in the vaccination nationalism games by having secured the most doses equivalent to 500% of its needs, and we have vaccinated almost a quarter of its population, this game is extremely problematic. The production delays at Pfizer's, BioNTech, and Moderna have created immense international tensions. Instead of each country participating together in the war effort to produce as many vaccines as possible, they are working against each other in a global distribution of vaccine organized according to the company's priorities. More than 800 million doses of vaccine have been administered worldwide since the 19th of April, and 82% of these doses have been administered in rich countries, while only 0.2% have been administered in low-income countries, mainly through the COVAX initiative. It is estimated that the poorest countries will have to wait until 2024 to vaccinate their population. But Pfizer has just announced that its vaccine may require boosters, even a third dose, and maybe an annual boosters, which will further extend the time frame for low-income countries. Canada has a vaccine production capacity, so why isn't it being used right now for the COVID-19 war effort? Canada has announced at the end of January an investment of $126 million in NRC to develop their production capacity. And this is you have Piovax, which is also there, and they have their chain, a production chain that's available, and they could start producing the vaccine right now, but they don't have a licensing agreement with the company, and Canada is not giving them any help in terms of negotiating further. So we have a production capacity that is not being used. Pharmaceuticals has applied to put COVID-19 products under Schedule 1 of the Patent Act, which would allow them to produce and export J&J's vaccine under a compulsory license. For example, through Canada's Access to Medicines regime. However, Canada refuses to amend Schedule 1 to allow a Canadian company to produce vaccines for low-income countries in the context of a pandemic. And this is absolutely unacceptable. At this point in time, several countries, such as India and South Africa, are asking the World Trade Organization to suspend intellectual property rights related to COVID-19 in order to facilitate technological exchange and allow for an increase in vaccine production by the end of the pandemic. You have to understand, the suspension of the TRIPS waiver would be much more interesting than the flexibility with respect to Article 31, which where you need a compulsory license. And then you have to figure out how you can implement this within your country. However, this link to COVID-19 allows to have a collaboration between countries so that they will be able to help other countries to be able to use their capacities. South Africa and India are two countries that do have capacity for production that aren't being used right now because they're not able to have the flexibility. However, Canada, the United States, Europe, the United Kingdom, and Switzerland are adamantly opposed to such a waiver. In many ways, Canada seems to have chosen to be part of the problem rather than part of the solution. In its intervention at the WTO on December 10, 2020, Canada even came out and blatantly lied. And I rarely use such words, but they were saying that the flexibility within TRIPS was sufficient. There was no need for such a waiver since Canada was making available its Canada's Access to Medicines regime to allow low-income countries to obtain the necessary treatments when they have compulsory licenses without local manufacturing capacity. The CIMR is, in fact, such an inefficient bureaucratic atrocity that only Rwanda has used it once in 2007 to obtain AIDS treatments before denouncing the ineptness of the system, which is instead designed to make it harder to access drugs in times of health emergencies. The House of Commons even voted to reform the CMR in 2013, which was deemed completely ineffective. But delays in Senate ratification meant that this reform died on the order paper. But Canada even defended without laughing last December 10th at the WTO that if nobody used the CMR, that was proof that TRIPS did not need to be suspended. And we didn't need the flexibility. Once again, this is totally unacceptable. Rarely have I been more embarrassed to be a Canadian than when I read this ill-intentioned statement by Canada in face of such a critical global challenge as COVID-19. Canada must stop being part of the problem. What they need to do right now is, first of all, we need to list COVID-19 health products now under Schedule 1 of the Patent Act. And we also, if there are countries that are asking for an exemption, we need to apply now. But it can't be done now because Canada has not put these projects under Schedule 1 of the Patent Act. The second thing that needs to be done, we need to apply now for a TRIPS exemption for all COVID-19 products. And also, we need to encourage all initiatives now to allow open science and technology sharing for all COVID-19 products. I'm counting on Canada to be on the right side of history in time of pandemic. And I'm available if you have any questions that I could answer.
Thank you very much, Professor. I'm sure there will be many. Yes, on to Mr. Agnew, please.
Madam Chair and members of the committee, it's a pleasure to be back at the Standing Committee on International Trade. Given the ongoing vaccination program underway in Canada and around the world, this study does come at a critical moment. At the Canadian Chamber, I have the privilege of working with many of our leaders in the life sciences industry, and as you can imagine, we've been working even more closely with them over the last 12 months. Like many Canadians, I look back 13 months ago and consider how rapidly the industry has moved. And in preparation for this appearance, I actually reread some of the press coverage from spring 2020, which said it would take 12 to 18 months for a vaccine to be developed. Instead, industry has developed a vaccine in far less time, and that tremendous effort should not be forgotten. I raise this not as a spurious piece of hindsight perspective, but instead to underscore the importance of supporting innovation in the life sciences industry. The committee will be hearing from others who are in the industry and better placed to speak to the science, whereas I'm going to come at this more from the trade perspective. I want to speak first to the issue actually of the TRIPS waiver. Intellectual property is a critical element of supporting the innovation ecosystem that does create life-saving medicines. I mentioned a moment ago the breakneck pace at which innovation has occurred for the COVID-19 vaccines. R&D work is both capital and labor intensive. Without strong intellectual property protections in place, this industry-led innovation that we've seen over the last year would have been tremendously hampered and certainly would not have been able to have happened as quickly because there would not have been the adequate infrastructure in place to develop the vaccines. There's been no evidence that IP rights are actually causing issues with the vaccine rollout globally. The challenges instead are related to the scaling up of production and the very complex supply chains that go into the COVID-19 vaccine process. Pfizer alone, for example, involves 280 components, 86 suppliers, and 19 countries. There are also immensely complex storage requirements, sometimes called cold chain, as you may have seen in the media. I don't want to be glib, but this is far more complex than putting a couple of ice packs in a cooler box and shipping them off with some vaccines and vials. In this sense, the IP waiver proposal is a solution in search of a problem, since it would do nothing to address the underlying supply chain issues. For example, the shortages of lipid which BioNTech needed Merck to backfill last year. It's also important to take a longer-term perspective and recognize that if implemented, a TRIPS waiver would create lasting effects for companies and the decisions that they make about their future investments for R&D and manufacturing. And certainly there's also the concern of a tit-for-tat war as countries would go down this path. It's also worth underscoring that there's already a process, as you heard a moment ago, under Article 31 of the TRIPS for governments to invoke compulsory licensing. Given there's already a process available, which I should add has safeguards built into it, a broad and sweeping TRIPS waiver is actually an unnecessary mechanism. And given all of that, we hope that the government will not support a TRIPS waiver proposal that's being discussed in Geneva. I'd like to now shift to talking for a moment about the EU's measures on the export of vaccines. The Canadian Chamber has strongly opposed measures that could restrict the export of vaccines. This is not only in Canada's self-interest given our lack of domestic biomanufacturing capacity, but also because COVID-19 is a global pandemic that requires global distributions of the vaccines. Our primary concern with the EU's export measures are twofold. First, the directive leaves a significant amount of discretionary power to the European Commission and member states in its application. And I know firsthand that Global Affairs Canada, including Minister Ng and Ambassador Ailish Campbell, have been working very hard behind the scenes. We have seen the benefits given that no shipments to Canada have been blocked thus far. The same cannot be said for Australia, as the members of this committee I'm sure will have seen in recent media reporting. Second, the EU's regulations set a very unhelpful precedent for other jurisdictions and risks making this type of behavior much more acceptable, and other countries may be willing to execute these types of policies. The Chamber has been working closely with our business association counterparts around the world to deliver the message to EU decision makers that we should not be pursuing this message. Instead, we hope that the EU will focus instead on automatic approvals and shift the efforts towards a transparency-based mechanism. I'd like to spend a few moments just discussing from a trade perspective what some of the measures that could be pursued to ensure the movement of vaccine supply chains. First, building on what I said a moment ago about export restrictions, we do need to have greater specificity from countries on the export restrictions and their use as a policy tool. Much has been made over the last year about the phrase that export restrictions must be targeted, proportionate, transparent, and temporary. Canada can play a lead role in global discussions to develop something in practical terms to operationalize this. There's the upcoming G7 Trade Ministerial, as well as the G7 Leader Summit that are potential opportunities to move the dial forward. We also have upcoming bilateral discussions with the United Kingdom. Second, Canada should also continue to take a leadership role in the Ottawa Group Trade and Health Initiative and the Global Alliance for Trade Facilitation. Given the complexities of vaccine supply chains, we can support the developing countries by providing them with the know-how to get products across borders and into the arms of their citizens as quickly as possible. Three, Canada should continue to engage in ongoing efforts at the WTO that are being led by Dr. Ngozi on the so-called third way for voluntary knowledge sharing. This would stay in line with the spirit of TRIPS Article 31B that requires consultations with right holders. The International Chamber has actually been putting some thinking into this, and they're considering the idea of some sort of vaccine clearinghouse that could act as a forum to help take the heat out of what's been a very fraught issue and allow for actual evidence-based discussions on supply chains. This is something that we hope the Committee and Global Affairs Canada will be able to explore further. Thank you very much for the opportunity. Look forward to your questions.
Thank you very much, Mr. Agnew. On to Mr. Sorensen, please.
Thank you very much for the opportunity to join you today. Messenger RNA is the most effective vaccine technology on the planet. The European Union has indicated that it intends to move exclusively to messenger RNA vaccines beginning in 2022. The USA, while not publicly making this comment, has practically chosen messenger RNA vaccines for its citizens over other options by virtue of how it is procuring and distributing vaccines, not to mention the FDA's cautious stance on adenovirus-based COVID vaccines. I see from the numerous press articles that Canada is now actively contemplating or competing for 2022 booster vaccines. To date, only messenger RNA vaccine producers have publicly announced that they're working on a variant version of their vaccines for 2022 booster shots. Thus, I can only conclude that Minister Anand, on behalf of Canada, is negotiating with Pfizer and Moderna to secure booster mRNA vaccines for Canadians in 2022. Providence Therapeutics is Canada's only messenger RNA vaccine company, despite the fact that Providence has shared early clinical data with the Government of Canada that points towards a potentially best-in-class mRNA vaccine. And despite the fact that Providence with its partners has proven a clear path to manufacturing tens of millions of doses, Providence has not been contacted by Canada for its 2022 vaccine needs. We would welcome that engagement. Such an engagement would be consistent with every contract Canada struck with foreign vaccine companies in the summer of 2020 and would enable manufacturing to proceed as the vaccine moves through the regulatory process with Health Canada, just as was the case with foreign vaccine companies in 2020. If commitments are made soon, Providence Therapeutics can provide enough booster vaccines for every Canadian by the first quarter of 2022. Canada has within its grasp the opportunity to be the first country in the world to fully vaccinate its citizens with an mRNA vaccine designed to protect against variants. From day one, Providence has been prepared to prioritize Canada's needs. However, other than the purchase commitments by the province of Manitoba, we have received no indication that Canada is interested in securing Providence vaccines for 2022. On the other hand, Providence has received serious inquiries for 2022 vaccine supply from multiple foreign buyers. The COVID vaccines industry is worth hundreds of billions of dollars. As a measure of scale of the industry, Canada itself paid $8 billion on COVID vaccines in 2021 alone. Some portion of that economic activity could be boosting the Canadian economy and creating an export market instead of simply adding to Canada's import costs. Providence Therapeutics will be a major participant in the COVID vaccines industry. Here, before the Standing Committee on International Trade, we can all appreciate that Canada can and should lead other countries in demonstrating confidence in and buying Canadian-made vaccines. In this context, how sad would it be that the first major commitment for a Canadian-made vaccine should come from a foreign buyer? And how unthinkable would it be that Providence be forced to export world-class vaccines out of Canada when Canadian lives and livelihoods are under threat? None of us would want that. Early action by Canada can prevent what might be an unfortunate possibility. I would like to formally ask this committee to consider passing a resolution seeking a commitment from the Government of Canada that, if Canada continues to pass on its opportunity to buy Providence vaccines, then it will not interfere with the exportation of Providence vaccines produced in Canada to countries outside of Canada. Even better, please consider passing a motion which encourages the Government of Canada to support Canadian vaccine manufacturing by buying from Canadian suppliers. Now, that is the end of my prepared comments. Given the comments from the fellow witnesses, I would like to add that the intellectual property situation as it relates to messenger RNA is a lot more complicated than has been presented here. While my peers would like to, suggest that they're willing to share intellectual property, Moderna said that they wouldn't enforce patents. The reality is their vaccines have been sequenced, and that those sequences have been published. They are 90% alike. Really, the only gatekeeping intellectual property in messenger RNA is related to the lipid delivery. And that gatekeeping is actually held by a Canadian company called Genevant. And Genevant is being infringed upon and not protected. We, Providence, have licensed and secured a license from Genevant, and we're playing by the rules. We are prepared, as I mentioned, we're negotiating with multiple other countries to tech transfer. I'm not interested in selling doses. I'm interested in selling capacity. That's how this pandemic gets fixed. We are going to be reaching out and contacting the WHO and discussing ways that we can work with them. We've been contacted by a consortium out of Africa, and we're looking at doing that. We've been in discussions with the government of Mexico. We're not focused strictly on first world countries. We're focused on the problem, the worldwide problem. We need Canada's support. We need the ministries in Canada to share information across their ministries so that they can see what's being done. Providence has shared data that demonstrates that we are safer, we have less adverse events than our peers. We have a cold chain that has -20 for long-term storage and transport, and we already have 2-month data at refrigeration storage. And our immunological responses are superior. All of that will be confirmed publicly when we release our data to the public when the report is finalized from our phase 1 trial. But it is currently available to the Government of Canada for their review. I don't know what else to do. We're trying to help the Canadian government understand that we have this technology and we have a world-class technology at our fingertips. I welcome questions. Thank you.
Thank you very much, Mr. Sorensen. On to Mr. Daly, please.
Thank you very much, Madam Chairperson. I'm a partner at Norton Rose Fulbright in Montreal, where I am the Pharmaceutical and Life Sciences International Business Group leader. I specialize in patent litigation for pharmaceuticals and medical devices, so I have a perspective on how IP rights holders view and enforce their rights both in Canada and internationally. The views I express today are my own and do not necessarily represent the views of Norton Rose Fulbright. I'm going to talk a little bit about supply chains and domestic manufacturing. What are the implications for Canada in light of the COVID-19 pandemic? I will talk briefly about some of the controls that already exist in Canada over patents, including compulsory licensing, and then talk a little bit more about the intellectual property context internationally with respect to certain of Canada's international trade agreements. I'll speak to some of the enforcement mechanisms that are available under those agreements, and then I will deal specifically with the issue of the TRIPS waiver. As all of us know, manufacturing of many goods has shifted over the last decades to locations that offer economies of scale, lower costs, or more favorable tax and regulatory regimes. Medical goods are no exception. For example, China and India have become major manufacturers of active pharmaceutical ingredients and finished dosage forms in the last decades. Medical devices and personal protective equipment are often manufactured abroad. As Mr. Agnew mentioned in his presentation, and as we have seen over the last year, we've learned a lot from COVID-19. We've seen procurement delays, competition for scarce supplies, we've seen hoarding or export restrictions by some countries, and we've seen political interference in supply agreements. That leads to the question, which I think we've begun to answer over the last 13 months, should Canada increase domestic production of certain medical necessities, particularly those that are related to COVID-19? In many cases, the answer is clearly yes. Personal protective equipment, for example, will be essential in this and future pandemics, and we should maintain adequate stocks and have domestic sources of supply. When we talk about medicines, vaccines, and medical devices, the answer is less clear. It is impractical to have a completely domestic supply chain. There are simply too many drugs, too many components, and too many devices. As we've seen, and as Mr. Sorensen explained, some of the vaccines that are available today use cutting-edge technology that is available in very few places. Nonetheless, domestic R&D and vaccine manufacturing capacity is crucial for our country. In a paper that I published with some colleagues late last year, which I believe led to me being invited to speak today, we proposed a hybrid solution. This would allow regional supply chains for advanced complex supplies. This would allow us to retain efficiencies of scale. It would also allow us to take advantage of trade agreements that we already have in place, such as those with the European Union and the United States and Mexico. In those circumstances, we would be dealing with trading partners that have comparable environmental, safety, and labor standards, and standards that are often enforced by these international trade agreements. We generally share values and similar political systems with these trading partners. In concert with this regional approach, we would continue to develop a reliable domestic supply for essentials such as personal protective equipment and vaccines. And we all know about the manufacture of N95 masks in Canada by 3M, as well as the recent agreement with Sanofi for vaccine manufacturing capacity in Canada. Those are good examples of encouraging domestic supply, and the government can and should continue to encourage innovative Canadian companies in this area as well. With respect to intellectual property, not only medicines and vaccines, but medical devices and personal protective equipment can also be patented. And this is a complication which makes the TRIPS waiver very difficult to bring into practice, even if it were a good idea. And I'll suggest later that it is not. Encouraging domestic supply requires respecting the rights of intellectual property holders, and particularly patent holders. Patents are the most relevant type of IP protection in this area. As you probably know, there are already compulsory measures in place under the Patent Act. It's possible for compulsory licenses to be granted in cases of national emergency. One of the problems we have is it's not clear what a national emergency is. It's also not clear under the Patent Act how patent owners would be compensated in such cases. Section 19.4 of the Patent Act was implemented last March at the beginning of the pandemic, and it authorized the Commissioner of Patents to permit the use of patented inventions, including by private parties, to the extent necessary to respond to the public health emergency. It provided that patentees were to be paid adequate remuneration. This expired on September of last year, and it was never used. That, I think, is illustrative of the fact that allowing intellectual property rights to be overridden is not a good idea, and we've seen over the past year that it is not necessary, at least in the Canadian context. Canada, as we know, is signatory to several international agreements, such as CUSMA and CIIT. Both of these and TRIPS allow governments to permit use of patented inventions without the patentee's authorization in national emergencies. Again, there's no clear definition over what constitutes a national emergency, and one country's unilateral declaration of a national emergency could invite complaints or retaliations by other treaty members. That brings me to the specific TRIPS waiver request. As we know, some WTO members have requested a temporary waiver of TRIPS intellectual property obligations in response to COVID-19. In my view, there are multiple problems with this request. First of all, and as Mr. Agnew mentioned, we're unaware of any concrete examples that would justify such a waiver. The original proposal, which you can find on the WTO website, cites one example involving the governor of Kentucky and N95 masks from April of last year. That's the only example I saw on the WTO website. The request also asked for a very broad exemption to sections 1, 4, 5, and 7 of TRIPS Part 2. Again, there is no evidence that IP rights have impeded the international response to COVID-19. One other point which has not been touched on is even if one were to try to implement this type of waiver, there's no practical way to identify individual patents that relate to fighting COVID-19. Many people have focused on vaccines, for example, but let's look at another important tool in fighting COVID-19, a medical device such as a ventilator. Ventilators per se are not patented. What is patented are certain functions that those devices perform or components that are incorporated within them. These patents could be owned by the manufacturer of the ventilator or by related companies or even independent suppliers. The ventilator manufacturer may purchase patented components from third parties or manufacture them under license. There's no easy way to determine what patents are relevant. And as I said, this is a wholesale renunciation or waiver of patent rights for an indeterminate period. There's no guarantee that this measure would increase manufacturing capacity, strengthen supply chains, or improve distribution to less wealthy countries. There's also the risk that widespread disregard of IP rights could lead to inferior quality products entering the market and even facilitate counterfeit products entering the international supply chain. Rights holders can and often do license their technology to trusted companies, and they're able to enforce strict quality control. In my view, that's a better solution than a wholesale waiver of intellectual property rights. Those are my remarks. I look forward to any questions that you might have. Thank you very much.
Thank you very much to all of the witnesses. We'll go on to questioning from the committee members. Mr. Abatai, for 6 minutes, please.
Thank you, Chair, and thanks to all the witnesses. Great testimonies this morning. We know that European did temporary export transparency and export authorization mechanism. It's a protectionist mechanism. We know that even if it's temporary, I believe also the pandemic is temporary. On the other side, we see that India and South Africa asking for waiver, which is with a pushback from, we can see from the industries for sure, and by also some intellectuals' opinions and some business opinions on the waiver on protections. In Canada, we do have a history of not being able to protect a lot the intellectual properties, and we've been losing big deals on businesses, on opportunities. And we must remind ourselves that we are leaders in many fronts, whether on the pharmaceutical front or on technological fronts or others. But we seem to be failing. We do have a shortage of supply in Canada now. The delays on the orders that we have in place, the purchase orders we have in place, it could be related to shortage on the manufacturing or struggling on the manufacturing side. But at the end of the day, it's affecting us and standing in the way of opening our economy as early as other countries such as United States, Israel, and others. The question to Mr. Sorensen, you have a technology, you have a capacity, you've been talking to the government. I'm a businessman before I enter political life. How do you see, how can the government work better with you? Because this is very critical. To have security over our supplies at all levels is very important, and especially now with the pandemic. So how do you see the government have been working with you? What would you like to see changed, so in order to be able to have that capacity that we need? Thank you.
Thank you, Ziad. So far, the government's worked rather effectively when it comes to clinical trials. We've received support from the NRC, and we're in stage 2 with the NRC, and we've submitted our application to the Strategic Innovation Fund for phase 3. I do have confidence that as our program progresses through the clinic, that we will get appropriate support from the Government of Canada as it relates to clinical trials.
When did you start talking to the government, if you don't mind?
Well, the phase 1 was announced last year. We were approached by the NRC for our phase 2 trial, and we've had really good dialogue ever since phase 1 started, and that process has gone in. That started probably about 2 months ago, as we geared up to conclude our phase 1 trial and release data. Although the NRC is capped at $10 million, which is certainly not sufficient to carry out phase 2 and phase 3 trials. So the NRC has, through the bureaucracy, sort of elevated us back up to the Strategic Innovation Fund. That occurred about 3 weeks ago. And so we've been now working with the Strategic Innovation Fund. Would I like it to go faster? Yes. But it's still progressing. And I do believe that it will continue to progress, and that we'll get the support we need for our clinical trials. Part of the challenge that we have is, and we communicate specific challenges, the need of comparator vaccines. That was communicated last week to the Finance Committee. I've communicated it to multiple departments within Canada, and I'm still waiting a response. So there's certain things there. What really we're missing is the manufacturing support. And it seems like all of the manufacturing support is targeted at a facility. They want to go and do a ribbon cutting. What we need is the backing to go out and buy the raw supplies so that we can start making these important vaccines. I personally guaranteed this week $5.5 million on a purchase contract for lipids so that we can keep our timelines. I don't know what else to do. We need the government to engage, and the government to engage quickly if we want to have timelines that are relevant for the needs of Canadians, and really for what's happening. The worldwide pandemic is still going on. It's still critical, and that's really what's lacking. That's what I need. I need that engagement on the raw materials supply front, so that we can purchase those raw materials.
Thank you. I heard yesterday that
very briefly, Mr. Abatai.
Well, thank you anyway. That's 30 seconds. Yeah, you think
40 seconds.
40 seconds. I will sneak a quick question here. Some provinces, they're thinking to start making some purchasing agreements to buy COVID, to buy vaccine. Have you heard of that? And what do you think of that?
My understanding is that they really can't do anything internationally, and that's why there was some. Manitoba approached us, and we will be signing a definitive agreement with them this week. We've had some discussion with Ontario. That discussion is sort of on pause right now. They've got their hands full. Alberta has taken a different route, as far as I can tell, and they've asked for proposals because they're looking to sort of build industry, and that's currently being evaluated by PricewaterhouseCoopers, that proposal that we have for them. But
Thank you, Mr. Sorensen.
Yep.
Thanks.
On to Mr. Sarai for 6 minutes, please.
Thank you, Madam Chair. Thank you to all the witnesses. You guys are very insightful in your respective fields. Mr. Sorensen, I just wanted to ask, you're still in completed phase 1 and still doing phase 2 in trials, am I correct?
Our phase 1 trial is complete. Our last patient visit was our last follow-up visit for our subject is tomorrow. We will then lock all the data. Our CRO that's supporting us will complete the report, and that report should be available within 4 or 5 weeks now.
And you've received, I believe, funding from the federal government in the amount of, I believe, $5 million. Is that correct?
That is correct.
And what's your expected approval date for your, if all goes well on your phase 2 trials?
So we need phase 2 and phase 3 in order to receive emergency use authorization. We went to Health Canada seeking a combined phase 2, phase 3 trial, and Health Canada felt it would be more appropriate for us to split those trials to 2 discrete trials. That has the effect of extending about 3 months to the program. So we were hoping to have an approved vaccine October, November. I would expect that our vaccine will now be approved January, February of 2022.
So currently the vaccine is not approved. You're still hoping to have it approved, and we're obviously optimistic that we can get some Canadian-made vaccine, and yours is very promising. But as of now, is it correct to say it's not approved, and you're expecting approval at the end of the year or early 2022?
That is correct.
Okay.
If we wait till approval to start manufacturing, the lead times for manufacturing, we need to start now if we want to have doses ready when approval is obtained.
Thank you. My next question is to Mr. Daly. You've said hybrid solutions are probably the best in terms of creating regional supply chains as well as using existing trade agreements. But my question is, will trade agreements on their own protect us? What we've noticed in pandemics is, despite having trade agreements, governments sometimes hijack, in terms of PPE equipment, right off the tarmac. In other places, we've seen domestic interest, NIMBYism occur where nobody wants to have their vaccines leave. Do you think that trade agreements on their own will be able to protect us in the future, or do we need to create a domestic supply chain, not domestic production where licensed products can be made here, even if the patent and the product is owned elsewhere?
Thank you for that question. I don't think that trade agreements are ever going to protect us in every conceivable situation. As we've seen in emergencies, countries like individuals look out for their best interests, and they're always going to do so. Nonetheless, I believe that a regional idea allows us to rely more heavily on people with whom we have long-term and trusted relations, so those types of problems are less likely to arise in the future. We see and have seen in the past year that a lot of our supplies come from countries with whom we do not have very good relations, and with whom those relations are deteriorating. So I think the regional model would minimize some of the risks, but you can never eliminate all of them.
And what would be the best solution for that? Is that to have more production facility and R&D here, but as you can see, you can't always bet on that a Canadian manufacturer will come up with the solution. You have to hedge your bets everywhere, and as you had said earlier, Canada had the largest procurement of this, but they had to hedge across the globe to secure enough doses for Canada, and that may be the case in the future as well. So, what is the best way to maintain a secure supply chain for Canada?
I think you're right that we have to increase our domestic capacity. There's no doubt about that. That's a lesson we've learned in the last year, and we've seen some of the weaknesses of allowing a widely dispersed global supply chain. That being said, as I mentioned in my presentation, the whole world of pharmaceuticals, medical devices, vaccines is too vast and too complex for even very large countries to manage on their own. And it's simply not possible for Canada to be completely self-sufficient in every possible medical device or pharmaceutical that we might ever need. Increasing domestic capacity, encouraging research and development, and encouraging innovative Canadian companies is a great idea. And I think it's something we should do, but we're never going to be completely self-sufficient.
Thank you. My next question is to Mr. Agnew. I know you've said you're more from the commerce side of things and not the research side of things, but I understand that the economic recovery is dependent on mass vaccinations. How do you think the additional 8 million Pfizer doses this government recently secured is going to help speed up economic recovery and support Canadian businesses?
Well, I suppose it's ultimately up to the provinces to get them into arms, quickly. But certainly anything that gets more vaccines into country, helps. We do need to have better underlying infrastructure to get them into folks. And so one of the things that we think would help, for example, is prioritizing essential workers for the receiving of vaccines. So more helps, but you have to actually then distribute them once they're in the country.
Thank you. Thank you very much, Mr. Sarai. On to Mr. Savard Tremblay, please, for 6 minutes.
Hello. Please, can you hear me? I have a question. Please don't take it away. I wasn't called. There were problems for hearing me. So can you confirm that you can hear me? Yes, your sound is fine. Thank you. So I'd like to thank the witnesses for their presentations. Mr. Gagnon, we have had expertise in Quebec historically, and today it would seem that this expertise doesn't exist. What has happened and what can we know not to do? We've known that since 2003 with SARS, we need to have our own expertise. So what was not done and what should be done as of now? Thank you very much for your question. Well, yes, you have to understand that in terms of vaccine capacity production, we did have good production capacity in the past, but the public portion, well, it's the public authorities need to decide decide what the priorities are, and so we also talk about intellectual property. So I'm listening to my colleagues, and I think it's important, but I think generally speaking, there is a huge problem with intellectual property. It's health imperatives and intellectual property aren't always aligned. And so we have to be able to produce what we need when we need that. The CIIT Labs in Toronto was the major vaccine producer in Canada. We also had Institut Montfraquier in the Quebec region. And so that was privatized. We sold the CIIT Labs to Sanofi, and Armand Frappier, where there was a public-private partnership, and then it was sold to Shire, and that was later sold and broken up. And so the vaccine production capacity became a GlaxoSmithKline. property. So that capacity is still there, but it depends on how it's going to be used. If the private companies decide as to their priorities, it may not be the same as public health priorities. So when Armand Frappier was broken up, the argument was simple. The public should be working in the private sector. And so we were looking at production capacity nonetheless. So with the evolution of this production capacity, we're announcing the fact that we need to have this. We have 106 million invested. We do need to have public investment, but at the same time, there is $500 million of investment through Sanofi, who has the infrastructure, who has Connaught Labs in Toronto. But this agreement is confidential, and we don't yet know who will be making decisions as to what the priorities will be and how those facilities will be used. So I think that's a huge problem. An example. The Research Council at the time of the Ebola pandemic. Well, the Ebola virus is a huge problem. So publicly, we went ahead and worked on creating a vaccine for Ebola. And so we sold the license to a private company so that they would continue to develop and put into production this vaccine. And that company didn't do anything for 10 years. And so then we were waited for a new outbreak of Ebola. And then all of a sudden there was a panic. And so what we did was we resold the license to Merck at that point so that Merck would be able to produce the vaccine. So there were a lot of people there who were really upset that a small company would buy it cheap this license and then would resell it to a large company. I thought it was a scandal that there were 10. There had to be 10,000 who died of Ebola before we went ahead with the vaccine that had already been developed. So this is where you can see that this is an example where the financial incentive really doesn't respond to the public health needs. Thank you very much. With respect to this question of intellectual property, we have had industry representatives saying that the waivers wouldn't help because there probably is a lack of capacity to produce and personnel. Well, according to you, it's not the case. Well, I think that there is capacity here and it exists elsewhere, but you have to realize that there is complexity with the vaccine, and especially with the messenger vaccine. But so if you give the recipe as to how to produce this vaccination, it will be very difficult for a company to be able to start producing it overnight. There has to be an exchange, a collaboration, and an exchange of know-how, to have technological know-how. Right now, we don't have the capacity to allow this, but there are risks of litigation based on intellectual property if you move ahead with any exchange and collaboration and trying to set up this production capacity. So I think that's a huge problem. We do have tools in hand right now to be able to produce more and to be able to shorten this pandemic so that there can be an economic recovery much more quickly, and we're not using it because we have to preserve intellectual property rights.
Thank you. Sorry to interrupt. Mr. Blakey for 6 minutes, please.
Monsieur Gagnon, si vous voulez finir.
Mr. Gagnon, if you want to just finish your thought there, go ahead and do so. Well, thank you very much. What I was wanting to say was BioNTech that developed the Pfizer, and then it was Pfizer that began producing it. It was Oxford University that developed the AstraZeneca vaccine. So initially, this was a non-exclusive license with AstraZeneca, and then it became an exclusive license. And Moderna, this was entirely publicly financed. And so then we're saying, well, it's because of intellectual property that we were able to develop these vaccines. Well, I think there's a difference, a distinction that needs to be between intellectual property and that in terms of profit for large companies, when they had as incentive, the incentive is to share the least possible, because when they have control of the technology, well, then they can maintain their profit margins, and that's the issue. And we also see, or at least we're hearing, that there are differential pricing that doesn't reflect possibly the cost of production and of transport. But we still don't really have really good public information on prices that companies are charging for the vaccine. At what point do you think, Mr. Gagnon, that it would be important that we would not only have access to the technology and to the expertise, but that the companies would indicate that they're acting in public interest and that they're acting in a way that is transparent and in a way that we think that governments really should be demonstrating transparency also. So that is that all information as to how much money is being made, what the profit is on these vaccines, is in the hands of the private sector. It's difficult to evaluate how whether or not companies are really acting in the public interest, or whether they're abusing the public funds they've already received and through their intellectual property rights to be able to make private profit on a worldwide crisis. Well, thank you. This is an excellent question. I think that the main problem, this is a huge problem that we have with medication, for-profit medication. We're in a market where everything is done with confidential agreements under the table, and everything is in secret. And as an exterior analyst, I can't even know who's doing what and in which conditions. And this has become the new medicine market, something that's essential for public health. And everything is happening confidentially in hidden manners. There's no accountability. And so an example here is Moderna. For Moderna, and once again, there was no private investment for the discovery of the product, and Moderna is asking the highest price amongst all of the vaccines. And they even got the Shelley order as the one that's abusing the public sector. And so they were aided by the American government. So they have confidential agreements with the American government. So we would expect that the price in the United States would be quite low, but then Moderna can ask much higher prices in foreign markets and make a huger profit. And so there has been no private investment that for the development of this product. We're hearing frequently that for the production and distribution of vaccine, that it's most efficiently done within the private sector. But can we actually evaluate as to whether the production system that we have in place within the private sector is really actually the most efficient possible, or really at the end of the day, do we need to just have blind faith? We have to depend on the government to make a good evaluation. Answer. I think you need to understand that with the intellectual property and private sector, people think that that's the best way to move science forward, but I would like to let you know that we have the Neurological Institute of Montreal that has and others that have open science. And so for researchers, intellectual property has become an obstacle for be able to do research and to discover new products. So, of course, when you look in the business world, people will say, well, no, this is the best way to be able to attain high profits. But in terms of research, to be able to discover and develop products, well, intellectual property is becoming more and more an obstacle. And if we look in terms of the pandemic, in the first months we had open science and things moved forward very quickly. And the proprietary model of science, so when you have a health emergency such as we did, well, this would be a system that is going to have parasitical dynamics and price gouging types of behavior, but it's not necessarily responding to the health needs.
Time is up. On to Mr. Lobb for 5 minutes, please.
Thank you, Madam Chair. And just to kind of lay some context out, I'm from Ontario, and I think we're vaccinating about 110 to 12,000 people a day, as you all know, and we probably have the capacity to vaccinate anywhere to 400,000 to 500,000 people a day. In my area, Huron-Bruce, and if you want to go up into Grey, the population's just over 200,000 people, and at some of our clinics, we can do 2,000 a day. We can do in Hanover one day, they've done 3,500 a day. So the issue in Ontario, the issue in my area is supply. Everybody knows that. Everybody on this panel knows that today. That's what's led to all these lockdowns and the situation we're in Ontario. So the question is, how do we get more supply, not only for Canada, Ontario, but for the rest of the world? And I look at Mr. Sorensen there, and I think to myself, in your open letter you wrote to the Prime Minister, you indicated at some point in 2021 there would be potential production capacity of 50 million doses. And is that in your own facility or is that through a consortium?
Our 2021 production there's 2 stages for mRNA vaccines. There's a drug substance stage where you make the mRNA. That is taking place in North Dakota, and we already have that space secured for us. And this is at a facility that has got tremendous amount of experience, and we've already tech transferred, so they know how to do what we need them to do to produce at scale. The second part of that is done in Winnipeg, Manitoba, by Emergent Biosolutions, and we are tech transferring to them this month so that they know how to do the formulation portion of the process, and then they do the fill finish. Just with that existing capacity alone, once we start the process, the reason we could commit 50 million doses at that time is because we would be up and running, assuming we had bought the raw materials in January. We could have been up and running in July and producing. That would have allowed us to make 50 million doses. We did not get the support for the raw materials. The soonest we could be up and running now would be in September. We could still make tens of millions of doses. It's just there waiting to be turned on.
So one thing I would, and again, I'm not in your industry, so you're going to have to, just kind of bear with me with this question, is it's my understanding Moderna kind of had and you did touch on some of the Moderna stuff, but they made a kind of an open letter, an open commitment to say, hey, for our IP, our intellectual property, it's available. So how would that like, I'm probably naive here, but why not just in the meantime while you're doing this, can you not scoop that in and get rolling on and piggyback on their approvals?
I'm sorry, Ben, that was just a PR exercise.
Okay.
The reality is Moderna and all mRNA manufacturers understand that there's actually, in the mRNA space, there's very little IP. It's trade secret. So you can share your IP. I mean, you can share the sequence of your mRNA, but it's the trade secret and how you optimized it, what codons you used, and what's your purification process. Moderna's not going to share that. They'll share their IP, but nobody will know what to do with it. And the reason they took that stance is so they can sound like they're above the fray while they are trampling on a Canadian company's IP for the delivery. it was a strategic move.
Okay, well, that's thank you for that honest answer there for sure. Mr. Daly, like I've been on industry committee through the years and health committee through the years, and IP and the discussion and debate around IP rights at the education level, partnering with companies, or some young person comes up with a great idea, who owns the IP, the student, the university. I mean, these arguments and debates have been going over for a long time, but I'm just wondering, going forward, should Canada not look at a partnership maybe with the United States and Mexico and say, look, we're a economic zone here. We need to, when the next issue hits, pandemic, what have you, we need to not just have like an Operation Warp Speed, but three countries coming together, equal shares, to have the benefit that the United States is having right now. Is that possible, or is that pie in the sky?
Oh, thank you for that question, Mr. Love. There's two answers to it, or at least two aspects of an answer to it. The first is your idea is in keeping with what I suggested, that a regional approach to producing products to combat pandemics such as COVID is desirable. And, this region includes the United States and Mexico. So that's definitely something that I would encourage. In terms of whether these countries would be willing to merge their intellectual property regimes, that's a different question and not one that I'm qualified to answer. I expect that countries like the United States are going to insist on maintaining control over their own intellectual property laws. That doesn't mean that we can't work out ways to share technology and cooperate with each other in areas where our mutual interests are the same.
Thank you, Mr. Daly. On to Ms. Bendayan for 5 minutes, please.
Merci beaucoup, Madame la Présidente, et j'aimerais remercier à mon tour.
Thank you. Madam Chair, I would like to thank all of the witnesses for their presentations today. Maybe to start, I'd like to ask Professor Gagnon. I heard you speaking about the importance of sharing expertise and knowledge. I'm familiar with the area. My father is a researcher in a medical field, so I do agree with you with respect to open science and its importance. But we have heard in the committee a few days ago a few expert witnesses who told us that the problem is not necessarily the WTO agreements, but it's rather that we don't have the capacity in certain countries around the world. Almost every country, the developing countries, don't have the necessary capacity, even if there would be a waiver to the WTO agreements. I don't think that would really be a solution. What would you say? I think you may be on mute. Well, thank you very much for your question. My main answer, you have to look at the capacity production that's not being used around the world today. And what's important, I believe, is that we've created a system where the capacity to profit depends on maintaining control over the vaccine. What would be important to do would be to develop a system where the financial incentive would be the more people vaccinated, the more we can produce doses around the world. Well, at that point, more there will be profit at the same time. But that system would be the most simple. You buy the vaccine and you put it in a patent pool, and so then you give a revenue of 4%, say, for the company producing, and then the company would have an interest to maximize the exchange of knowledge and expertise and to collaborate with all of the different countries and producers. I'm sorry to introduce, I don't have much time, but you're talking about creating another system. So what we have before us is the really important subject is whether Canada should respond to developing countries to contribute in terms of the waiver with respect to intellectual property. And a certain number of witnesses have told us that would not solve the problem, really, the problem we have right now. Well, an alternative system is a long-term process. Right now, in the problematic situation we're in, well, yes, with a waiver for trips, it would be a first step to be able to get out of this blocked situation and create a new type of system for the future. Absolutely. Well, thank you.
To Mr. Brian Daly, and just for full transparency, Mr. Daly and I were colleagues at Norton Rose while I was in private practice. But Mr. Daly, one of the things that you mentioned that certainly piqued my interest and quite frankly my concern was the one of quality control. And you mentioned towards the end of your opening remarks that there may be issues of elements or products going into supply chains that wouldn't have sufficient quality control, and that could therefore impact the health and security of Canadians and quite frankly, of all people. I wonder if you could expand a little bit on that.
Certainly, Ms. Mendine, thank you. I read, as I said on the WTO website, the request for waiver, and it's framed in very general terms. It simply asks for a wholesale, basically suspension of, let's take patent rights as an example, essentially in several countries. If you were an IP rights holder and you wanted to license production of your patented product in another country, you would enter into a licensing agreement with a third party. And in that licensing agreement, you would have quality control provisions. You would say your product must meet certain standards. That's how you would do it normally. If you just say all bets are off, all patent rights are suspended, you don't have any control over who's going to make those products, who's going to practice those patented inventions. And that's where you lose control over the process. And I think that is an area that the waiver request, as far as I've seen, simply doesn't address.
Thank you very much, Mr.
Sorry,
Daly.
your time is up, Ms. Mendayan. I'm sorry.
Thank you.
On to Monsieur Savard-Tremblay for 2.5 minutes, please.
Merci.
Thank you. We've been able to see Mr. Gagnon. Let's come back to you. With the COVAX initiative, we were not always able to have the contracts with the companies, as Canada, for example, that is ready to pay more, but Canada feels that it's that they've had a good success. And what is your opinion? Well, in fact, no. COVAX, you have to understand, it was set up in order to be able to be a worldwide response, to be able to have a pool of for the patents. So this needed to respect. Yes, well, you have the patent pool that was one of the suggestions, solutions you're suggesting. Yes, it would be a good solution. So with respect to COVAX, the problem is that now we have another competitor with this nationalism, this war between the countries as to who can access the vaccine. And COVAX has not been able to be competitive in a market where the richer countries can pay higher prices for their doses. So after all, right now COVAX is still having huge problems in terms of supply. And so it was good that Canada would participate, but Canada has gotten another 500, gotten more access through COVAX. So, well, I don't think we're really helping at all. So this is not helpful because rather than having a global collaboration, it's becoming just one initiative amongst others that is in parallel with others. Well, yes, we're becoming a competitor amongst other on a worldwide market. And so it's only the richest countries that have access. And it's only 0.2% of doses have gone to the 2.5 billion people that are in developing countries. So this is a real problem. COVAX is not able to fulfill its mandate. And at The WTO, they're saying they want to be able to encourage companies to have more licensing contracts with other partners. Well, yes, of course. Normally, if the companies from the start had an interest in terms of maximizing their licenses agreements everywhere, we would have had greater capacity to be able to have production, and we would have been able to have vaccine around the world. But
my apologies for interrupting. On to Mr. Blakey, please. 2.5 minutes.
Thank you, Mr. Gagnon. When we talk about what's being proposed, which is a temporary and targeted waiver on the TRIPS provisions at the WTO, often it sounds as though some witnesses, a committee anyway, imply that the governments who are asking for this waiver don't understand the complexities of vaccine production. I'm wondering, and then are further asked to, we hear a lot about the importance of the privacy of commercial agreements on the end of, companies that are producing vaccine. And then in respect to the waiver, we're told, oh, well, governments should be disclosing which companies in their domestic jurisdiction might be able to produce vaccine on what terms if they had an IP waiver. I'm just wondering, is it normal that, governments would expend as much time and energy and effort on asking for an IP waiver if they didn't believe that there was untapped domestic capacity that could actually produce more vaccine? Like, is this just it's almost as if we're supposed to believe that this is just some sort of political hobby horse side project that governments in the middle of a crisis have decided to take on, that they don't believe is or either don't believe would produce any results or don't understand the industry well enough and aren't talking to industry players at home. Is that plausible that they would be spending this much time and energy on something that has no promise of increasing vaccine supply?
I thank you for the question, and I really think that contrary to Moderna, this is not just a PR exercise. Basically, it's just there is real untapped vaccine manufacturing capacity that does exist that is not being used fully, and WHO agrees with this statement as well. And the thing is, what do we do now? It's there, and we're just putting in place obstacles in order to make sure that we're not using that. And keep in mind, it's just there's this idea we're going to get everybody vaccinated, everything is over. No, we might have to renew vaccinations. There might be new variations of the virus that will emerge as well. We're in this for a very long ride, and just let's focus on 5 or 6 companies that and just knock at their door every 6 months in order to have new doses. This is not the way to go for a global emergency in terms of public health.
And if
Thank you, Professor. Sorry, Mr. Blakey, your time is up. On to Ms. Gray for 5 minutes, please.
Thank you, Madam Chair, and thank you to all of the witnesses for being here today. I'd like to go to Mr. Sorensen from Providence Therapeutics first. And I think a lot of people will be shocked to hear that as a Canadian company, you've received serious inquiries from other countries, but not from within Canada for vaccine procurement. Well, you have from the province of Manitoba. And you had mentioned that you're interested in not only producing mRNA vaccines for Canada, but also for exporting, including to developing countries in need. And you mentioned in your testimony the company Genevant, and you said, in quote, if I could quote you, being infringed upon and not protected. And I'm wondering if you can maybe explain what you meant by that.
So Genevant, prior to being Genevant, was a company called Arbutus, which is prior to that was a company called Tecmera. Many of you may remember Tecmera from the Ebola crisis in Africa. They were at the forefront in Canadian papers a lot. They were another company prior to that. The group that's in Vancouver that is currently Genevant has been there for over 15 years, probably 20 years. They hold all of the foundational intellectual property related to lipid nanoparticles that are used to deliver RNA medicines. They've successfully defended themselves against Alnylam, Acuitas, Moderna in the past. and a multiple of other companies. So right now they're a private company. Like I said, they've gone through a few different iterations, but they hold that foundational technology. We've licensed that from them, and I know that they're, you know, I won't speak out of turn. It's their company. You can approach them and talk to them, but it's pretty clear that, you know, that their technology is not being respected throughout the international community, particularly by those that are making billions of dollars selling mRNA vaccines currently.
Okay, thank you. You mentioned that Canada paid $8 billion for COVID vaccines, and would you say that Canada would better secure our future by having investments in domestic capacity to produce mRNA vaccines versus having to rely solely on imports of vaccines subject to, you know, potential export control measures at present, but also, you know, taking vaccines from COVAX, which are better suited potentially for developing countries?
Well, all I can point out is that, as has been mentioned by this committee, mRNA vaccines are the more expensive vaccines, and there's a reason for that. It's because it's a quality issue. You've got the CEO of Pfizer indicating that prices of vaccines are going to go up, not down. You know, and to answer Daniel's question earlier of how much profit is being made here, I can tell you, we're an open book. It costs us about $5 Canadian to make a dose, and we're using third-party support right now. Once we have it integrated in Canada, that price will even go down further to make the vaccine. So you guys can do your own math, but you know, and with regards to large pharma hasn't supported anybody in this besides themselves. J&J got $1 billion from the US government, $1 billion. And when they had their vaccine approved, they had 5 million doses ready for distribution. Okay. If I had $1 billion, like I just can't comprehend how that happens, how the largest pharmaceutical company in the world can get $1 billion free and have 5 million doses ready for distribution.
Okay, I've got limited time here, so I just want to ask a couple other quick things here. As you're getting ready to manufacture here at home, once your operation is scaled up, how many vaccines would your facility or facilities be able to produce on a monthly basis or weekly or yearly? What kind of numbers are you looking at?
The emergent facility with some very modest upgrades, about $5 million worth of upgrades. So we have a dedicated line within their facility out of Winnipeg, could do 200 million doses a year.
Okay. One other quick question here. I think I've got time for one more.
20 seconds.
Okay. Do you see that your vaccines might potentially be available to lower or middle income countries?
Well, that's what I'm focused on right now.
Okay. Great. Thank you, Madam Chair.
Thank you very much. On to Ms. Bendayan for 5 minutes, please.
Thank you very much, Madam Chair, and I will continue on my previous line of questioning with your permission with Mr. Agnew. Mr. Agnew, just picking up on something another colleague on committee mentioned earlier, and that's with respect to the current third wave that we are in, and of course, I am extremely concerned about the situation, particularly in Ontario right now, as I'm sure all of my colleagues are. But linking, vaccines to the third wave is in some ways simplifying a very complex issue. We see countries around the world, there's Chile, that have an extraordinary vaccine rollout that is also in a third wave, and we also see the situation that Canada is in. We are currently number 2 in terms of vaccinations per day per capita in the world, and among G20 countries, I believe we are 3rd overall, behind the UK and the United States, which is quite good company. And our very much committed as a government to continue moving vaccination forward as quickly as possible. But there are, of course, a number of different situations and complexities at play when it comes to the third wave and the reasons for it. I guess I would ask Mr. Agnew if you feel that our business community in particular is engaged on this issue, and is there anything that you think that the government can be doing, including, of course, support for continued vaccines entering the country, but is there anything that is missing from our strategy at present, Mr. Agnew?
Well, thanks for the question. So I think there's a couple of things that come to mind. And foremost, businesses are looking for clarity, particularly around what variants of concern mean for their operations. I mean, we're seeing in other countries mask mandates are shifting in terms of types of masks that people should be using. So that would be one thing that I would say. As vaccination rates increase, there's also a lot of questions around what can I as a Canadian do once I've gotten my first or second dose. So I think getting that sort of clarity on a national level. But one of the most important things that we need to really up our game on is around rapid screening. Right now, we're in a world where there's a lot of warehouses that are filled with rapid test kits, either federally or provincially, and we need to be able to enable more Canadian workplaces to implement rapid screening practices. And I think enabling lay people in particular to take on more responsibility and having provinces change their rules is a big thing that is currently missing.
Thank you very much, Mr. Agnew. And when it comes to rapid testing and rapid screening, we did provide rapid tests to provinces and territories. Do you get the sense that they are being used on the ground? Have they been deployed by provinces and territories?
Some more than others. I mean, in Ontario, notwithstanding what we're seeing with the third wave, there's more work being done to roll those out, and our colleagues in Cambridge and Kitchener-Waterloo at their chambers have been stepping up, but certainly other provinces have been less willing to enable the sort of, as we call it, task shifting that needs to take place to let lay people take on more work.
Thank you. And turning now to Mr. Daly. Mr. Daly, we heard from a witness earlier this week some of the flexibilities that are already included in the TRIPS agreement. He cited several articles, three different articles in the TRIPS agreement, which provided flexibilities that would help developing countries access vaccines and encouraged all countries to be using those flexibilities. What is your opinion on the existing mechanisms available under TRIPS, and do you think that they can be used to success?
Thank you, Ms. Mendine. I'm not sufficiently versed in the finer points of TRIPS to really answer that question. I think that, as I said earlier, wholesale renunciation or waiver of patent rights is not the way to go, but I certainly think any measures that the international community can implement to encourage production in other countries is welcome.
That same witness also cautioned against a waiver of TRIPS and how it would impact our own life sciences sector here in Canada and possibly stymie innovation for Canadian life science businesses, here at home. Would you agree with that assessment?
Yes, I would. And I think there's a couple of things that we need to keep in mind. Some people have mentioned that the intellectual property prevents development of new medicines, and it would be great if everybody just had access to open source intellectual property. The problem is that's only the first part of the equation. It takes an enormous investment of time and money and resources to get from the idea to an approved product. And you need to have a infrastructure in place that allows that to happen. Otherwise, you're not going to get the type of intellectual property that we need. And the other thing that we need to think about as well is we were able to achieve vaccines in a record period of time because there are well-financed large companies with the resources that are necessary to do that type of work. If you don't have the infrastructure in place that encourages that, you're not going to have those large, well-resourced companies to take on the next set of problems that we're going to face.
Thank you, Mr. Daly. On to Mr. Abatai for 5 minutes, please.
Thank you for opening again the question. I go back to Mr. Sorensen. I'm very curious about the process when it comes to getting ready. And I always believe, regardless which government in place, usually the red tapes are something that stand in the way of any development as such at very important and critical time where we know that we need to act fast and we need to deal fast with a pandemic and with solutions. Can Mr. Sorensen tell us what the most significant roadblock in his way, in his company's way, to be able to develop the vaccine and to be able to start producing it, knowing that in the United Kingdom, within 10 months, they were able to set the manufacturing capacity and to produce vaccine, and they are ahead of us by far when it comes to the per capita vaccine providing.
Thank you for the question. We have the ability to produce vaccines. That work that you're describing has been done in Canada. All of the processes, the manufacturing process, the supply chain, everything that we need to start producing mRNA vaccines in Canada is in place. The only thing that's missing is the capital for us to secure the raw materials and commit to the plant times. We've put a budget forward to the Strategic Innovation Fund that would accommodate for the clinical trial material, but they've clearly communicated to us that that's where their mandate is just strictly on clinical trial, and that it does not encompass scale up for manufacturing, for commercial. And so, you know, I've reached out and I've asked if they would put me in touch with, I spoke to the Finance Committee, I'm speaking to this committee. Quite frankly, I'm not that familiar with government as who makes that decision. Maybe that's minister or not at procurement. If I had an order, I'm not looking for a handout. I'll take an interest-free loan. I'll take a deposit on an order. I don't care how it comes. I just need the capital so that we can start the process.
We've spent billions of dollars on this. There's other companies in Canada that got some nice purchase orders to supply some PPEs. So why not? And how much capital you were looking for? I mean, I know that could be in the millions, but that's nothing compared to the amount of money we've spent so far. And this is very critical because this is not just the solution for today. I think having companies such as yours will be solutions for the future, knowing that vaccine and problem as such that it needs it will be something that we're going to have to deal with for decades to come. So how much capital were you looking for, and why not? Why you haven't been able to get that? And you mentioned that you don't know who to talk to. This is concerning.
Well, we're talking to anybody who will listen. Thank you. The simple answer is, as I mentioned earlier, our costs are $5 a dose. And those costs, 80% of that, $4 of that is material costs that we have to spend upfront. In this environment where there's so much demand for this type of product, we have to make commitments 7, 8 months in advance in order to secure these supply chains. So if you want 50 million doses, it's simple: 50 million times 4, 200 million. If you want to have enough supply for an entire 200 million production run, that would be 800 million. Now, the reality is once we get there, we're going to be able to sell some vaccines, and we'll be able to use revenues to continue to purchase supplies. But I hope that's a straightforward answer.
Let me ask you a business question. If the government extend a purchase order to your company, wouldn't you be able to leverage that to get some funds to start producing?
Oh, 100%. And people ask me, well, why, if your stuff is so good, why don't you go out and raise money in the market? Well, it's a point of value inflection. Yes, we're going to go to the capital markets. We're going to bring significant capital into Canada, but why would I do that at a competitive disadvantage to other companies that have received significant support from their governments and disadvantage my existing shareholders? I know what our data is. I know that we are going to be able to do deals based on our data. And if we don't get the upfront costs from Canada, we'll get upfront costs from other countries. The problem is then we'll have committed that production to another country and we'll be exporting it out of Canada when Canada potentially needs it.
Thank you, Mr. Sorensen. On to Mr. Raya, please, for 5 minutes.
Thank you, Madam Chair. My first question is to Mr. Mark Agnew. Mark, you and I, we both support free trade agreements. We have talked, I think, in the previous committees too. But with Kusuma, with CITA, we have these free trade agreements that sort of made us dependent on our partners to keep the supply of essential goods and services open. Now, with the current situation, do you think our dependence on critical pharmaceutical products on the free trade agreement, that come back to bite us?
Well, I think in terms of how historically trade agreements have been interpreted, governments have very large berths and lots of latitude to interpret what national security exemptions and public health exemptions mean in practice. So I think in a sense they've come back to bite us as only insofar as they were never really designed to protect us in these types of situations. And so if the EU decided tomorrow to block a shipment, I don't think we'd be able to bring it.
So does it mean that we have to develop our new strategy to have self-reliance on critical items that are required to keep our society functioning?
Yes, and that includes being able to manufacture, source inputs, finance, as Brad's talking about, have the regulatory and the labor mechanisms in place, absolutely.
Thanks. My next question, Madam Chair, is to Mr. Brian Daly. Brian, you talked about the regional approach. So you are basically, if I'm not wrong, you're suggesting a sort of a regional approach that creates interdependence will ensure that the supplies are there when we needed it, if my understanding is right. And also opposing waiver, you mentioned Kusuma and CITA, they have solutions, but they seems to have not worked, or it may be possible that the solutions that are available currently may not result in the immediate term. What do you think?
Well, I think, as one of my colleagues said earlier, we are getting suppliers who honor their contracts with us. So we have not seen our major trading partners impede supplies to Canada. My idea behind the regional suggestion is we really shorten some of the supply chains and we limit the number of countries that we deal with in order to reduce risk. I think, as everybody knows, in a crisis, you're never going to be able to enforce through what is essentially a contract between states, honoring that contract in cases of national crisis. People are always going to act in their self-interest in a crisis. But I think reducing the number of people we depend on helps us achieve a higher level of security, while the idea of absolute security is never going to happen.
And, I think I heard differing views. Mr. Mark Andre Gagnon seems to suggest that production capacity is not a constraint, while Mark Agnew seems to suggest that production capacity is a constraint. Mr. Mark Andre Gagnon, can you address this, please?
It's not an issue with the production capacity being constrained or not. It's the question of, do we have available production capacity right now that are not being put to use? And the answer to this question is yes. And the other question is why? And on this, trying to maintain the system in place will not help putting to contribution production capacity. We have Mr. Sorensen here, but we would have basically the same story by Donald Gersten at Pneuvax, for example, who could tell you exactly the same thing, the same issues he has in order to try to start producing the vaccine. And if we don't have a government that is putting its weight in order to help these businesses, these partners, or produce these vaccines itself through public manufacturing capacity, basically we're stuck in the situation we are right now.
Mr. Agnew, what do you say?
Well, I think just to clarify my early remarks, when I was talking about the manufacturing piece, it was very in specific reference to the TRIPS waiver specifically. And so what I'm talking about is by waving a magic wand over the TRIPS waiver for 6 months, that's not going to suddenly make the capacity issues in other jurisdictions, go away. And so I think that's just a nuance I want to put there.
Thank you very much. Your time is up, Mr. Aya. On to Mr. Savard Tremblay for 2.5 minutes, please.
Yes, I'd just like to add something to Mr. Gagnon. You spoke about the WTO within the agreements. Is there something specific that should be modified, reformed, or reviewed? Well, that's a good question. But are we talking about regional accords such as CIIT? Yes, CIIT is a good example. There are provisions that say that we can't, there's nothing to anticipate that would give any type of exception. So that would be an example, yes. Well, there are differences between the agreements and the interpretation of those. With TRIPS, since the 90s, there have been different ways of interpreting the agreements. That was TRIPS plus, if you were, in one interpretation, and that was extremely problematic, and it forced the Doha Declaration, that is, to accept greater flexibility, because we were seeing that in terms of public health emergencies, that wasn't. It was problematic. So are there things that need to be changed? Well, I think yes, of course there would be things that would be changed, but it would depend on how things are interpreted. Mr. Daly is saying when we're talking about health emergencies, things are not clear, and the companies are going to fight to define what a public health emergency is. We are in one right now, but the different clauses aren't being used right now. So the idea here would be that Canada has to stop moving ahead with a position with this TRIPS plus approach, with the interpretation where we're trying to reduce things as much as possible, even if we're not suspending the TRIPS agreement. The fact that within Schedule 1, the COVID problems, COVID products are not there. That's a problem, because there you have the flexibility within TRIPS will not be able to be used for those products, and that's unacceptable. So if we want things to work better, suspending the TRIPS agreement, that will allow for greater exchange of technology and knowledge, and that will help a lot in the war against COVID. Thank you very much.
Mr. Tremblay, on to Mr. Blakey for 2.5 minutes.
Thank you, Mr. Sorensen. I just wanted to ask you, I mean, we know that in the rush to try and get the initial vaccination done, that Canada is very reliant on some of the large pharmaceutical companies. I think that's an understatement. But we also know that as the pandemic continues, if COVID-19 vaccines are going to become part of a kind of regular vaccination course, that it seems to me it would be in the long-term interest of Canada to have a more competitive market, and in the long-term interest of Canadians to have domestic supply. But the behavior of the government in terms of not, providing support for what you guys are doing out of Calgary and Winnipeg is inhibiting that. Do you have any concern that the short-term imperatives of the current vaccination rollout is causing the government to behave in ways that discourages competition in the long term?
Thank you for the question, Daniel. I'm not sure, what goes into the negotiations as Canada is negotiating with these, large pharmaceutical companies for additional supply. So I don't know if there's, competition restrictions involved in those negotiations or not. I would hope certainly not.
What I'm hearing from you at committee today is a pretty open approach in terms of transparency on your part and on your company's part.
Yeah.
Do you think that the larger companies are meeting that same standard? And do you think that if they aren't, that they should be? And what do you think that looks like in practical terms?
I have the advantage of being a private company that I have a lot of control over. So I don't need to go through a board of directors and shareholders and all of the requirements associated with a publicly traded company to provide that type of clarity. And obviously there's differential pricing across different countries. So I have an advantage. I can be a lot more open and transparent, and I've given the commitment to Manitoba that they can disclose our purchase agreement once the definitive agreement's in place. I have no problem with that, but it's unfair to say that I'm doing better than them because I'm in a different circumstance.
Right, Mr. Gagnon, I wanted to ask if you could maybe speak quickly to the extent to which over the medium term in the next several years we're going to continue to need vaccinations. From a public policy point of view, is this something that really ought to become a cash cow for large pharmaceutical companies, or is this something that we're going to continue to have a public interest in? And the economic costs of not having that ongoing vaccination effort mean that this really isn't the kind of thing that should be for private profit. At the very least, we should be able to monitor it to see if those profits are excessive.
Very brief answer.
Well, you're absolutely right. And let's keep in mind that many companies pledged that they would not making profit during the pandemic. However, once the pandemic is declared over, the vaccinations will still have to continue for generations, basically. And then we do not have a clue how much will be the price for these vaccines.
Thank you, Professor. Mr. Hoback, 5 minutes.
Thank you, Chair, and thank you, witnesses. I'll start off with you, Mr. Agnew. We've seen the EU brought in this implementation list or the restriction list on the exportation of vaccinations. Canada didn't get an exemption. Does that not concern you?
Yes, it does.
So a verbal agreement means nothing unless you're actually on the exemption list. Is that fair to say?
Yes, it is true that there's a lot of discretion, so a shipment could be blocked at any time.
Okay. Mr. Daly, you talked about creating supply chains and looking at our supply chains in a more holistic fashion with our like-minded countries. I'm hearing that quite often from other people around the world saying the exact same thing. One thing I'm concerned about is this government went and relied on China at the start to do its supplying. And we don't have an FTA for China. We don't have a lot of issues. We have quite a few other issues with China that we don't agree on. Is that a prudent approach, or are we better off taking an approach at working with the UK and maybe France, Australia, New Zealand, US, and putting together and making sure we have capacity to take care of all of our needs within that block, for example?
Well, that's largely what I've been suggesting, is that we have a more regional, more limited concept of supply chains. As I said, it gives us the advantages of economies of scale, but it also reduces at least one level of risk from our supply chains.
Okay, and then Mr. Sorensen, you talked about your facility that you've already signed an agreement. Is that facility not being used right now? And if not, why isn't it doing vaccines for Pfizer or somebody else at this point in time until they're ready to take on your product? Why is it sitting there vacant and not being utilized?
Randy, it's not so simple as just to say we're going to make this, we're going to make that. If you're going to make, as it was mentioned by other witnesses, it's more than just a recipe. It's you have to do the tech transfer. You have to do an audit of the facility, all the quality control that's associated with all the release criteria. I mean, you see what's happening with in the States, where there was 15 million doses of Johnson & Johnson that were lost.
But then that makes the argument then that to go and just say here's the recipe to other countries just doesn't work. You actually would be better off actually making sure you have a good, strong system of producing them here in Canada or another like-minded country, and say, hey, we've got capacity to help you out, and we're going to help you out by donating or giving, instead of stealing the intellectual property and sharing it in a situation that may not be safe for the people that are getting that product at the end of the day. Is that fair to say?
Yeah, so Providence's approach on this is the countries that we're discussing, we're actually talking about jointly putting in a facility in that country and training and having control over the quality of that facility. So we're open to tech transfer. We're open to sharing the technology so that, i.e. Australians will make vaccines for Australians. But, there's a certain process and the standard that we expect as a company so that, our vaccine isn't going to be produced inappropriately.
So, Mr. Sorensen, can you explain to me then, like Vito here in Saskatoon, in Saskatchewan, has done great work in regards to COVID research before the COVID crisis, in different variants and different strains. Now, they applied maybe 3 years ago now to actually set up a manufacturing facility under the clusters, but understood they were just totally ignored. Why are we not seeing that being revived, and why are we not seeing those types of investment happening now? Because if we know that this is going to be an ongoing, why aren't we making that investment here in Canada? And again, I find it so frustrating because we're willing to invest in other countries and we're willing to buy from other countries. Yet if you want something from Canada, it seems like you have to go to the US to get it, whether it's electronics or wine or anything else, and now it's vaccinations. So can you explain that to me? Or maybe it's unfair to ask you.
I can't get into specific case scenarios, Randy. What I can say though is a lot of the focus seems to be on the manufacturing, getting in the large, fill finish facilities and, being able to go cut a ribbon and say, look, we're making these here. The truth of the matter is there's an overbuild going on throughout the entire world for manufacturing capacity. Everybody's doing the same thing Canada's doing, and they're building up manufacturing everywhere. And in 5 years, if this pandemic tampers down, or even if it just mitigates somewhat, we're going to have such an overwhelming oversupply of biomanufacturing capacity. It's going to be breathtaking. What they won't have is the products to go into those facilities. And besides Providence, there's fantastic companies doing tremendous R&D in Canada. And so we keep talking about the manufacturing, but manufacturing will come where there is successful products. Like, we didn't have to go out and create new manufacturing in order to do what we're doing at Providence. We created a successful product and we found and secured the manufacturing necessary for it. Any group can do that.
That feeds into this age-old argument with Canadian research. We're great at research. We're horrible at bringing it to market. So we take our research and we give it to somebody else like China, and then they bring it to market. So how do we change that?
Very briefly, Mr. Sorensen.
Honestly, I have a strategy for that. I worked with Terry Fox Foundation, Princess Margaret Cancer Foundation, Alberta Cancer Foundation, OICR, that we were going to prove that method out in cancer. It's on hold because of the pandemic. If anybody is interested in learning more about it, please feel free. I don't have time to go into the details of this meeting.
That's unfortunate.
Thank you to our witnesses today for your very, very valuable testimony. We appreciated it. Just for the information of committee, on Friday, April 30th, I'm suggesting that we conclude the examination of the 2 draft reports. And starting on May 1st, that we start the study of the Canadian exploration of green, clean, and low carbon technologies. And all witnesses should be in by this coming Wednesday, your suggested witnesses. Okay, thank you all very much. To everybody, have a great day. Meeting adjourned.